What brought you to this field, Dr. Shad?
It goes back a long time ago when I was a medical student in Karachi, Pakistan, at Dow Medical College, one of the premier institutions of the country, also attached to a general hospital where the poorest of the poor came for care because free care was provided there. I was always interested in taking care of children. So while I was working in pediatrics, our days would begin in the morning, seeing children with infections, seeing children with malnutrition. Kids would come in with diarrhea and vomiting. I would start at one end of the room, putting IVs into patients, and by the time I got to the end of the room to put the IV in, the first one had already come out. So you started all over again. That was the kind of place that we learned and learned precious lessons. But at the same time, there would always be children with cancer who also came in, children with leukemia, children with bone tumors, children with brain tumors. Number one, in this hectic environment of trying to take care of hundreds and thousands of children who were almost ready to die from infection or malnutrition or diarrhea, nobody had time to devote to a child with cancer. Besides, treatment of cancer is expensive compared to other illnesses. So they were disregarded. We were never really even taught how to recognize their symptoms, to understand the pain that children go through, to see that there was even a possibility of cure. And one of the two things actually affected me the most and changed the trajectory of my life. One was a notable professor in Pakistan. There were two kinds of people that I saw and who mentored us. There were people who were brilliant but not great communicators and probably did not have the empathy that it takes to sit down with the family, spend time with them, and explain to them what their child was going through. And then there were the others who were absolutely wonderful, who understood that if you didn't take care of a family well or a child well, you would not be able to succeed in what you were trying to do. And I remember being in a room with one of them, and a family came in with a child with a bone tumor. And he looked at the child for barely 5 minutes and then said to the family, "There is nothing I can do for your child. Think of him as having died in a car accident."
Oh,
This was a young family. This was their first child. How could you have even said something like that? You could have still given the message that there was not much you could do because we were not developed or capable of taking care of children with cancer, but you could have done it in a better manner. From that day onwards, I teach communicating bad news to medical students at Georgetown, to residents at Sinai, to anyone who walks into my clinic, the importance of what it means to establish relationships with families, the importance of breaking bad news, irrespective of whether it is telling somebody that your child has cancer or trying to explain to them that in spite of everything that you did to make their child better, the disease keeps coming back, and helping them change their hope from the hope for cure to hope for a comfortable death with dignity. And that takes time, effort, and learning.